Hello, my name is Gantul. I study in class 531 of School of Medicine. And now I'm going to talk about the dry eye syndrome. So, what is a dry eye syndrome? It is not a disease entity. So, basically, it's not a disease, but it's a complex of symptoms. And it occurs due to deficiency or abnormalities of the tear film. And it also results in ocular surface diseases. And those ocular surface diseases are keratoconjunctivitis sicca, xerophthalmia, which is caused by the vitamin A deficiency, and xerosis, which is severe conjunctival cicatrization. And cicatrization basically means scarring. And Sjogren syndrome, it is an autoimmune disorder. So first, let's discuss about tear film. And the tear film consists of three layers: the mucus layer, aqueous layer, lipid layer, or oily layer. And if you would like to know more about these layers, you can look it up in your textbook, which provides a lot more information. And the main functions of the tear film are very important. It keeps the cornea and conjunctiva moist, it provides oxygen to the corneal epithelium, washes all the bad debris away, and also prevents infection because it has antibacterial substances. And it also facilitates movements of the lids over the globe. And the tears are secreted all the time throughout the day, and it is secreted from two glands, from accessory and main glands, and it is eliminated as well throughout the day. And so it's secreted from the glands, and it covers all the eyeball surface, and then it reaches the lobar fornix, then into the inner canthus, and then at the end it enters the nasal cavity. So it is eliminated by active lacrimal pump mechanism, which is activated when the person closes and opens his or her eyes. And the reasons of dry eye syndrome are there are lots of diseases, and it depending on the layer, which layer, it's different. So the aqueous tear deficiency is the main cause. Is the main cause of the keratoconjunctivitis sicca. And as you can see, there are these diseases, as well as there's mucin deficiency dry eye. And this happens when the goblet cells are damaged, so it cannot produce the liquid mucin. And then there's also the lipid deficiency in abnormalities, which is relatively rare, and impaired eyelid function, which can be the paralysis or other diseases, as you can see, and epitheliopathies, which is the alteration in corneal epithelium. So the clinical features of dry eye syndrome are basically easy to know. The symptoms are irritation, foreign body sensation, feeling of dryness, itching, as well as non-specific ocular discomfort, and chronically sore eyes not responding to a variety of drops which have been instilled. And the signs are the signs that we can see during the examination, while the symptoms are the things that the patient is saying. So the signs are presence of stringy mucus and particulate matter in the tear film, loose release ocular surface, conjunctival sclerosis, or reduced or absent marginal tear strip and corneal changes in the form of punctate epithelial erosions and filaments. And if you would like to know more, you can also look it up in the books, which I will show you later.
It's 23 hours.
And the tear film tests are the most important. So from these are the main criteria for diagnosing. So the diagnosis is confirmed if three out of these bolded tests are positive. So basically, the tear breakup, film breakup time, Schirmer test, and vital staining with Rose-Bangle are the main three tests. And if two of these are positive, then the patient has a dry eye syndrome. So the tear film breakup shows the interval between a complete blink and appearance of first randomly distributed dry spot in the cornea, and I'll tell you what the dry spots are later. And there's a drop of fluorescein dropped into the eye and examined in a cobalt blue light of a slit lamp, and it indicates the accuracy of mucin components in tears. And if the dry spots appear within 15 to 35 seconds, then it's normal. And if it appears less than 10 seconds, then it says that there is an unstable tear film. And here you can see on the upper picture, it shows just an eyeball, and then in the lower picture, if you can see closely, there are black lines, which are the dry spots. Basically, here you can see how it looks like with a cobalt light. So the tear film another test is Schirmer test. It measures the total tear secretions, and we use this. If you can see this 5 millimeter times 35 millimeter paper, and if it's and the person cannot blink or look up or close the eyes, and after 5 minutes of the filter paper is measured, and if it's more than 15 millimeter, then it's normal. If it's less, if it's 5 to 10 millimeters, then moderate to mild KCS, and if it's less than 5 millimeter, it would be severe. So here you can see that the tears have been the tears have wetted the paper almost at 20 millimeters, which means normal for this person. And another test is rose bangle staining. It's very useful for detecting even mild cases of KCS. And there are 3 staining patterns: ABC, C being mild, B being moderate, A being severe. So what happens is the rose bangle staining should not the normal eye should not actually become rosy colored, so it shouldn't absorb the stain. But when there is a dry eye syndrome, the stain would basically be absorbed into the eye, and if it's all pink like this, then it's the severest form. And if it appears only like as dots, then it would not be as severe. It would be mild. So in this case, it's severe. And the treatment of dry eye syndrome are quite difficult because there's no cure, only the control of the symptoms and prevention of surface damage. And the other things are supplementation with tear substitutes, topical cyclosporin, mucolytics, topical retinoids, preservation of existing tears by reducing evaporation and decreasing drainage, punctural occlusion, decreasing room temperature. And one thing that we really should talk about is Sjogren's syndrome. It's an autoimmune chronic inflammatory disease with multi-system involvement. It typically affects women who are 40 to 50 years of age, and the main feature is an aqueous deficiency dry eye, which is the KCS. So there are primary and secondary ones. The primary is patients present with Zika complex, which is the combination of KCS and xerostomium, which is the dryness of the mouth. And then the secondary Sjogren's syndrome is when the dry eye or the dry mouth are associated with an autoimmune diseases, commonly rheumatoid arthritis. So basically, it affects the systemic organs. And then the presentation is in adult life with greenness of the eyes and dryness of the mouth. And then the signs are enlargement of the salivary glands and lacrimal glands, which causes diminished salivary flow rate and dry fissure tongue. And another sign is dry nasal passage, diminished vaginal secretion. So basically, all the mucus secretions are diminished. And Raynaud phenomenon and cutaneous vasculitis. Raynaud phenomenon is when the hands and the feet are quite cold, and arthralgia, myalgia, and fatigue are present. So the complications of Sjogren's syndrome are dental caries in severe untreated cases, and reflux, esophagitis, and gastritis, malabsorption, pulmonary disease, renal disease, polyneuropathy, and lymphoma. And the diagnostic tests are serum autoantibodies, Schirmer test, and biopsy of minor salivary glands. And then the treatment options would be symptomatic treatments and salivary stimulants and immunosuppression with systemic steroids and cytotoxic agents. So it's quite difficult because it's an autoimmune disease. So I have used these books and these websites, which were very useful. And thank you for your attention.